Hi, this is Dr. Priyanka Reddy from DNA Skin Clinic. Today I'm going to be demonstrating Subcision RF in an acne scar client. So if you observe, you can take a closer look. So you can see the ice pick scars, box scar, rolling, all type of scars are present. So the client is ready. The area to be treated is cleaned, prepped and sterile. So this is the radio frequency machine that I use, and we have cables attached to the machine. If you see, so this cable is for the Subcision cannula. The Subcision cannula gets attached to this probe right here, and this is a metal plate that we attach to the client very close to the area we are performing the treatment. Now this is the cannula that I will be using to perform Subcision RF, and this is about 23 gauge needle, and we'll also need another needle which is about 18 gauge to create the entry point, because this is a cannula. So if you see, this is a grey colored cannula, which is, so grey colored indicates 23 gauge, and when we take a closer look at this, you see this is a blunt cannula that has an opening to it, and this is all insulated cannula. So this has two openings to this, one that goes into the probe and the other one is a point where you can fix another syringe into it. Thereby you can do PRP treatments or your fillers, or also can keep injecting local anesthesia while you're performing the procedure. So this is an entry point for, this is an opening for another syringe that can be attached, and this is where it goes and sits into the probe. So this is how it sits into this. So like mentioned, since it's a blunt cannula, we are creating an entry point using an 18 gauge needle. Okay, so let me show you the settings quickly. So this is the machine. So when I turn it on, I have a Subcision option, and then depending on the patient's tolerability, depending on the number of session and severity of the scars, you can also decide the intensity. And this is in the cannula mode, and this shows the shot count. So I've turned it on, the machine is now ready to operate. So this can be operated using a foot switch. The entry point is created. So I'm now sending the cannula in. You can see the movement. So right now I'm only doing Subcision. I'm still not playing with the RF energy as yet. I'm just doing the Subcision. So I can feel the fibrous bands being broken. You can see the movement. So I'm doing the fanning technique here. And now I'll be starting with the RF energy as well. So you can hear the sound. Can you see the movement? So you can see that the tissue is getting heated up locally as the RF energy passes inside, and also the texturing of the fibrous bands because of the cannula. So you could be doing the Subcision RF for about 3 to 4 minutes roughly on each side, or you can stop when you feel the tissue is gotten significantly heated up. And continue with just Subcision. If you feel that there's too much of heat, you can continue only with Subcision till all the fibrous bands are broken down. So we do the same procedure on the other cheek as well. So what else you could be doing in the same session? Now since Subcision RF is predominantly targeting dermis without having any significant effect on the epidermis, and if you want to treat the epidermal layer as well, you could be doing sublative RF or microneedling RF in the same session, which usually we combine and do. And now because we've seen that the cable also has another entry port for another syringe, so you could also be, and also the cannula has an opening, so you can comfortably be doing procedures like fillers or your PRP and growth factors in the same session as well. And what you can expect after Subcision RF? Well, because if you don't do anything else and it's only Subcision RF, there could be mild swelling that we can observe for about 2 to 3 days. And if you're also doing other treatments that is affecting the epidermis, obviously you'll have some erythema that comes down in a couple of hours. But if it's only Subcision RF, it is only about mild swelling.